Wykeshia Farley, and this presentation is on National Patient Safety Goals. The Joint Commission on Accreditation for Healthcare started National Patient Safety Goals to help improve specific patient outcomes in the hospital. The Joint Commission determines the highest priority of the patient goals and make them specific to the organization. The National Patient Safety Goal that I'm presenting today is correct patient identification. Use at least 2 patient identifiers to identify patients. One of the things that we use in the inpatient rehab facility to identify our patients is the name and date of birth. We compare that to the patient's armband to make sure that we have the correct patient whenever we're doing treatments. The purpose of National Patient Safety Goals is to improve patient safety. The specific goals and aim is to solve problems within the healthcare facility that result in near misses, incidents, and to decrease the risk of adverse events. National Patient Safety Goals, such as this one, help prevent unfavorable outcomes in institutions like the one we're serving in rehab. However, it also helps produce favorable outcomes to those such as the hospital itself and the physicians that take care of the patients. It also has a direct impact on the hospital's revenue cycle. Some of the changes that can take place to improve patient outcomes are making sure that we use the 2 identifiers and make sure that we compare it to the armbands on the patients. Another thing that we do is when we're doing specimens and collecting blood, we do it at the patient's bedside and make sure that we use our 2 patient identifiers and label the specimens at the bedside as we identify the patient with the name and date of birth. Another way that we do it is through registration. Upon registration and entering the hospital, the starting point is where it all begins, and we want to make sure that we identify the patients correctly so that they process through the healthcare system in a favorable way. We use the name and date of birth and make sure that the name, date of birth, and all the other identified information during registration process is correct, so that the armband has the correct information on it in order for us to use it at the bedside for point-of-care services. A case study done by Improvada and Pullman Institute was done to look at some of the things that happen because of misidentification of patient errors. The primary cause, through this study, we identified the primary cause of misidentification was through incorrect identification at the registration desk. If you don't have the correct information at the registration desk, then when you process through, that becomes a problem for the point of care. It makes it hard to use the armband if the correct information isn't entered correctly during the registration process. This study also showed that misidentification at registration will result in medical errors at the point of care for treatments that were given at the bedside. Respondents of the survey attributed inaccurate patient identification as a reason for 35% of all medical claims being denied per year and per hospital. There were 3 articles that I used to produce evidence and show outcomes and how identification can be a barrier in patient safety. The first one is the influence of quality improvement efforts on patient outcomes, nursing, and nursing work. It's a perspective from chief nursing officers at 3 large health systems. Do y'all have any questions about patient identification? Or would you like to share some of the things that you've noticed at bedside?
Medication errors have been reduced due to the scanning of the armband at the bedside.
Especially with blood administration, it's very important and it produces favorable outcome when you use 2 patient identifiers.
Exactly. This article is on barcode scanning, which is what you discussed about administering the medications at the bedside. If you have to use an armband that has barcodes on it, as well as medications that have a code, then you can link the 2 by using those to scan the patient's armband and scan the medication to make sure you have the right patient, the right medication, you're giving it at the right time. And this prevents errors in medication administration, and it also prevents adverse events. second article. It's positive patient identification can dramatically improve patient care and the hospital's bottom line according to the new report. This one specifically tells how it affects the hospital and the bottom line reports at the hospital. A lot of times we don't think about what happens when we have near misses and adverse events. It not only affects the patient, but it affects the hospitals and it affects the revenue cycle as well. In this one of the survey respondents suggested that biometrics be used to identify patients as well. Respondents also stated that using biometrics at registration to correctly identify patients could result in reduced denied claims by an average of 25%. And that is an improvement for patient care and for hospitals' bottom line. This third article is on quality and practice and its implementation of hospital guidelines for patient identification in Malawi. This hospital had some of the same problems with identifying patients due to patient safety. And they tried some different things to use to identify patients. And what they started doing was using the wristbands. As a solution for this facility, they used the World Health Organization guidelines and they used patient identification wristbands. They encouraged it among their staff and everybody, and they used the staff as well as the patients to help implement this process. Throughout the process, they realized that using the wristband was a perfect solution for them, and they continued to use it. As for their long-term implementation, the facility compiled interventions that they could use that would help them further in the process of identifying patients. These are the references for all of my information that are on my slides. Are there any questions or remarks regarding patient identification?
I had a question about same name or same birth date, the solution to identifying those patients.
Well, through my research process, that was one of the barriers that was identified. And that's why they introduced biometrics at the registration point, because they have so many people with the same name, same last name, and possibly the same date of birth. So they felt like biometrics was a solution to that. It would give them more of validation of patients and identify them at registration, so that as they go through the hospital process, that'll prevent errors with their armbands and everything being correct. And when you pull them up on your electronic health record, sometimes you have the same name, same date of birth, but you also have other identifiers like their hospital numbers, medical record numbers, and things such as that to help identify them. Any other questions or remarks? All right, well, that's the end of our presentation on National Patient Safety Goals and Correct Patient Identification.